My name is Sophie Choi, and today I will be presenting about the impact of rare diseases on global health. Here is a little bit about me. I am a rising junior at Mission San Jose High School in Fremont, California. Some of my past experiences include being an intern for Scleroderma United, an international nonprofit. During my time as an intern, I wrote a published article about the disparities in women's diagnosis for rare diseases, spoke to my school to raise awareness, and also raised over $620 for the development of the first ever course for children with scleroderma. Additionally, I hold officer positions in school clubs like Women in STEM and Generations G, while also volunteering at my local hospital. I have a strong interest in music, specifically cello, and I am in the Golden State Youth Orchestra Senior Symphony and have won and performed at multiple local and international competitions. I am interested in going into medicine and research in the future while also continuing music. Now I will be giving an introduction to rare diseases. What is a rare disease? Even though rare diseases are rare and each disease only affects a small number of individuals, it is a major global and public health issue. So, what is a rare disease? Different countries classify rare diseases in different ways, but each one affects a small number of individuals, usually with fewer than 1 in 2,000 people affected in a region. The graph here shows the differing prevalence around the world, meaning what is considered a rare disease. There is no universal definition, but the global average is 40 per 100,000 people. They are often genetic and tend to appear in childhood, with around 2/3 living with a rare disease being children. Even if there are only a small number of people living with each rare disease, there are more than 7,000 types of rare diseases that exist, resulting in 300 million people worldwide living with a rare disease. Here are some examples of rare diseases in different categories, such as scleroderma, an autoimmune disease, retinoblastoma, a cancer, and mitochondrial disease, a metabolic disorder. In addition to the ones mentioned on the slide, there are over 7,000 types of rare diseases, most of which have no cure. Now I will be talking about the challenges in providing equal healthcare for rare disease patients and their effects. First, I will introduce orphan drugs. Orphan drugs are drugs that are developed to treat rare medical conditions. They offer higher health gains than non-orphan drugs, as shown in the graph on the left, based on a research by Dr. Chambers in 2020. Orphan drugs are indicated with red and are shown to have around 20% of QALYs, or quality adjusted life years, that are greater than or equal to 0.9, compared to around only 5% for non-orphan drugs. This means that orphan drugs offer a larger median incremental health gain compared to non-orphan drugs. However, shown on the graph on the right, orphan drugs have a much higher percentage of incremental cost, greater than 175,000, compared to non-orphan drugs. Therefore, most companies avoid developing these orphan drugs because they tend to be less cost-effective and give them less profit. Additionally, it is difficult to recruit enough participants for clinical trials to do research when creating orphan drugs, due to the small number of people affected by each rare disease. People with rare diseases face similar challenges globally. Around 95% of rare diseases lack approved treatments, and around 30% of children with a rare disease die before being 5 years old. A survey from rare disease families from the UK and US, conducted by Dr. Chung, shows that patients typically visit 8 physicians and receive 2 to 3 misdiagnoses before receiving a correct genetic diagnosis, over a period of 5.6 to 7.6 years. Not only do patients lose precious time before getting diagnosed, but it is also extremely expensive, with all the unnecessary medical follow-ups from all the diagnoses. During my internship with Scleroderma United, I experienced firsthand the challenges that come with this global health issue. Scleroderma is an autoimmune rare disease where the immune system is unable to distinguish invaders from itself and attacks the body's tissue. It was difficult to make an impact or do outreach because of the lack of awareness people had with this disease. I pinpointed the main problem and found it was simply because people were not educated. The picture here is an article I wrote regarding this rare disease. So, how can we contribute to this global health priority? First of all, it is important to raise awareness and recognize the importance of rare diseases. Rare diseases have always been unknown to the public due to the small number of people it affects for each disease. However, as shown in this presentation, there is a large number of people suffering as a whole and facing the same situations. By raising awareness through organizations or advocacy groups, we can make the public more knowledgeable and then hopefully bring this issue to the legislation or government. For example, the Orphan Drug Act, which was passed in 1983 in the US, provides incentives for pharmaceutical companies to develop treatments for rare diseases. These can include tax grants, tax credits, grant funding, and market exclusivity. This graph here by pharmaceutical technology shows the total number of drugs that gained their first orphan drug designation ever since the Orphan Drug Act was passed. The number of drugs increased and more than doubled after 2010 compared to the previous decade. Additionally, global health initiatives like the International Rare Diseases Research Consortium can give additional funding for research and development of drugs. It is the policies and international initiatives like these to be applied to every country that can improve the lives of rare disease patients around the world. Now I will be giving a conclusion to this presentation. Rare diseases face many challenges as a global health issue. Even though it may seem difficult or even impossible to achieve the goal of providing efficient and equal healthcare to rare disease patients, students like me and you can make a huge step towards that goal. You have to start small to be able to reach the bigger goal, and you are taking the first step by watching this presentation and gaining an understanding on this global health issue. Here are my references. I would like to thank my family, Scleroderma United, and the GHLC team for providing me with this opportunity, and the audience for listening. If you would like to contact me, please feel free to reach out with my email, and thank you all for listening.